Hey guys, it's Dr. Watt from 𝒃𝒆💏 Chiropractic. Let's talk about our 3 favorite adjustments to do when you're struggling with sciatica. And so we have 3 different ways to do it. Our primary one to use is this flexion distraction table. This works really well on opening up that space for patients who are having sciatica from a disc or a lumbar spine injury. As we talked about before, sciatica is when pain's coming from the sciatic nerve, either starting in the low back, into the hip, or all the way down the leg. And so this first treatment is going to work really well, especially for that lumbar spine area, whether it's a disc or whether it's something else in that area, a subluxation, something putting pressure on that. So first thing we'll do is we'll stretch this patient out. This is the distraction part, and then we'll move them into flexion. And so this table is going to swing up and down. I've got a handle up here on her lumbar spine so we can work through each specific segment. Moving her feet up and down are going to pump those joints here. So that's going to, one, get those joints to move a little bit better, take pressure off the sciatic nerve at the nerve root itself, and even start to help with that disc healing. This is one of the other treatments we do for disc injuries, which disc injuries can often cause sciatica. And so if this is not the right fit for that patient or this isn't the way we want to treat them, the next step that we'll do is going to do a drop table. Now we've used these drop tables on other types of adjustments before, and this works really well on both the lumbar and or if your issue is coming from an SI joint. And so we'll differentiate those 2 things during an exam. The table pops up like that, and then as we press down on the low back, the table's going to make a big pop and bump like that. And so what we'll do is we'll be right on that contact, putting force through that joint, whether it's the SI joint there or whether it's the lumbar spine, or if we need to attack both individually, we will. But this type of adjustment is going to better restore that motion through the joint, helping the healing process that's happening in that area to take pressure off that sciatic nerve and decrease the symptoms that are radiating down the leg. So that's our second favorite type of adjustment for that. The third type of adjustment we'll do is what's called side posture. So I'll have you lay on your side facing me. And this is kind of like a big chiropractic pretzel. This is going to allow us to get some more of a rotational force through the lumbar spine. This can also adjust the SI joint as well. So this type of adjustment works great for either SI or lumbar, depending on how much torsion we have on this and what point we are dropping on the patient, right? So we'll turn towards me, good. So that motion there is going to go through that SI joint and or through that low back and get those joints to move again. Once again, getting pressure off that sciatic nerve and keeping that irritating pain that's going down the leg. As we treat, we'll oftentimes see that pain start to centralize, meaning it's not going as down the leg as far. So sometimes that means it's going to have less less leg pain and pull it more into the low back so we can continue to treat. But those are the 3 of the best ways to adjust for that. If you want to figure out which one's going to work best for your condition, come on in, let's chat about it.